we're going to try to rapidly move through a review of muscles. The first time we go through them, they might be in order, and then we might actually do them out of order. I've got them in both ways so that you don't just kind of memorize orders and things like that in your head, because we're trying to review. But today is all about, can I identify pictures of muscles? And then later we might ask you questions about them too. I know actually some of you have even come to me and said, make it a little bit harder on me, and I would love to. And so some of you I may ask additional questions on top of this. But anyway, again, we are not testing you today. We are not judging you today. At least I'm not. We're here to study together. This is fun. And this will really help you prepare for the test at the end of the year, because as I've said many times, some of these exact pictures are used because that's what we have. So this should give you a really good idea of kind of the pictures you'll see at the end of the year, and also the types of questions that we might ask about them, right? Because I made the test, and so I can't help but just kind of speak to you in the language of the test, if that makes sense. Yeah? Yeah. Okay, let me share my screen, and I probably am going to go through you guys, like calling on you in alphabetical order. So that kind of lets you kind of know when you might be coming up in rotation too, if that helps you, because I want to kind of see if we can't pop through some of these kind of quickly, because I'd like to go through them several times and then add layers and see how much we can get through. Okay. And we will take a break in about half an hour here. Do-do-do-do. Boop. Love it. All right. Okay. This should be familiar, right? Muscular Anatomy Boot Camp. I'm not going to go through all the preliminary stuff again, but we said there's all these different muscles in the body and you can't really memorize them all. You should kind of figure out how they're named, because there's just too many. And we said there's very common features of muscles. So I'm not going to go over that. We're going to go over the actual muscles today. Miss Abelos, I'm going to call on you first. Okay. Miss Abelos, what muscle is this? And are you there? Hold on. Yeah, Miss Abelos, you've got your hand raised. Can you not speak? If you can't, type it in the chat. That's my guess. Miss Abelos? Okay, she's left the meeting. She's going to try to pop back in, I think is what she was trying to tell us. We're going to try that. Okay, Miss Carrillo, what muscle is this?
The rectus femoris?
Yes. What makes you think it's the rectus femoris?
Because it's going up and down. It's the one that's going up and down straight in the middle, and it looks like it's the superficial one.
Yes.
It's higher than the vastus intermedialis.
Yeah, what's one other thing that makes it different from the vastus intermedialis that's right underneath it?
It looks like it's going to the hip.
Yes. The fact that it's sneaking up underneath that guy's shorts is actually important because it means it crosses over the hip joint. The vastus intermedius is shorter, and it hooks only to the femur and doesn't go across the hip joint. That's very good. Ms. Carrillo, what actions can the rectus femoris perform?
It could flex on the hip. It can flex and extend the knee.
Yes. Flex the hip, extend the knee. Last questions. What's the name for the hip joint? What's the name for the knee joint?
Oh, shoot. The hip joint is that hole, that one hole, the acetabular?
Yeah, the tab that you hook your ass on with. The acetabular. Yeah. That's just how I remember.
And the knee.
Wait a minute. Acetabular what, though? It's the acetabulum connects to the what?
Acetabular connects to the greater No, not the greatest.
What bone?
It's
What
the,
bone?
oh, the femur.
Yes. So it's called the,
Oh, acetabular, the,
yes. You, by the way, you were about to say it
femoral?
correct. Say it one more time.
Acetabular femoral?
Yes. Acetabular femoral joint or coxal joint, some people call it too, but I really like the acetabular femoral joint because it lets you know
Yeah,
what's really
it
going
is.
on there. Cool. And what's the knee called?
The knee one, I actually don't remember.
What two bones come together at the knee?
So the femoral and, oh, the tibia?
Yes. So say it with the tibia first.
Yeah, tibia femoral.
Yeah. I think it's tibiofemoral joint, but that's perfect. Tibiofemoral joint. That's perfect. That's great. Thank you, ma'am. Thank you. Thank you. That was good. We're off to a good start. Miss Clayton.
Yes.
Miss Clayton, what muscle is this?
My hand's full. Yes,
Yes. What muscle is this, ma'am?
that is the vastus lateralis.
Is it on the lateral side of the leg?
Yes.
Really? Can you see this guy's lateral side of his leg right now?
No.
Because I
Okay,
can't.
so there's the, is it the vastus intermedius?
Yes. It's the vastus
Okay.
intermedius. Why is it not? Why is it
that
not?
was more
Why is it not the rectus femoris that's in the same place?
because it's not going all the way up to the AIIF.
Thank you. Yes, it's not going up to the. That was great. She remembered the origin of it. It's not going up to the anterior inferior iliac spine. Super well done. What actions does this muscle perform, ma'am?
It flexes the knee and
Let's go back to that one really quick.
okay.
To flex the knee. I know it happens in front, but knees are opposite.
Okay, never mind. It moves the leg forward. What is it? Extends the leg.
Extends the knee. Extends the knee.
Extends the knee. Okay. So extends the knee.
Awesome.
And
That's all it does.
Is that it?
That's it. Extends the knee all day long. What is the name for the knee joint?
The tibula femoral joint.
Tibiofemoral joint. I love it. Last question. This thing has an origin on kind of the anterior lateral shaft of the femur. It goes down and inserts. Where does it insert? Where does it hook into?
It goes down under the knee to where all of these guys, all four muscles insert in the same place.
Good.
I can't remember what it's called though.
What is the name of that sesamoid bone?
The patella?
Yeah, they all insert into the patella, and then the patella is attached by a ligament to the tibial tuberosity.
That's what I was thinking of, the tibia, which is right underneath the patella, correct?
Yes, yes, ma'am. It's a bump that we can all feel on the front of our shin. Yeah.
Yeah,
Well
I was
done.
feeling it yesterday on Mrs. Pugh, and it was actually pretty pronounced.
Yes. Yeah. So, well, some people are just more pronounced than others, but yeah, it's fairly pronounced if you know where to find it. Yeah.
Yeah,
Thank you, ma'am.
cool.
Good
Sure.
stuff. Mr. Craven.
Yes,
Mr. Craven, what is this?
that's gotta be the vastus lateralis.
Yeah. What's its action or actions?
Extend the knee.
Yes. What's the name for the knee joint?
Iliotibial, femoral. Yeah.
Cranial.
No, iliotibial is the IT band, right?
Yeah.
Extra points.
Extra points for that question. Yes.
And then it's the give me a hint. Give me like a little
Well, you name joints by the two bones that come together to form the joint.
right.
So
Yes.
this could be, I don't know, where the humeral ulnar joint, but I wouldn't pick that one because that's your elbow.
Yeah.
What two bones come together to make your knee? What's your thigh bone called?
femoral.
Yes, yes, your thigh bone is your femur. Tibio,
Tibiofemoral joint.
yes, tibiofemoral joint. Excellent, sir. Do you know, this is hard. Do you know the insertion for this muscle, where it inserts? It's where all 4 quads insert.
Oh, the patella?
Yes, it inserts into the patella, and then where's the patella hook to?
The lateral lip of the linea aspera, gluteal tuberosity, and the greater trochanter.
Thank you for the origin. That's awesome. That's where it starts on the leg. You're absolutely right. That was going to be my next question too. And then they all insert into the tibial tuberosity via the patella and the patellar ligament and tendon, right? All your quads come down to your kneecap, everybody, and your kneecap is hooked into your tibia, into a bump there called your tibial tuberosity, which is,
And it's like hooked in to the joint by like a little tiny tendon underneath the actual like patella, right?
no,
There's something that
no,
holds
thank you for
together.
asking, sir. Thank you for asking. Literally, if you can see me, all 4 of these tendons come together and they actually wrap around your patella. It's why it's called a sesamoid bone. It's wrapped in tendon. They don't stop. They wrap around your patella and then they turn into a ligament that comes down and attaches into your tibia. It's super key for why your knee is strong and your thigh doesn't blast out over your leg and stuff. So all 4 quads insert into your tibial tuberosity, but they do it by going into your patella, and then your patella is hooked to your tibial tuberosity. Got it. Cool. Yeah, very important. Hand signals, very important. Thanks, sir. Good stuff. Okay, Miss Dang. This one right here.
This is this vastus medialis.
Yes,
Is that
vastus medialis. That was awesome. Yes, 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 yes. Okay, where does it insert? Where does it hook into?
let me
It's the same place. Oh, go ahead. Go ahead.
What is the and the order, right?
Insertion.
Tibial tuberosity.
Tibial tuberosity. Yeah. Via the patellar and patellar ligament. That was fantastic, Miss Dang. We'll take it. Thank you.
Thank you, sir.
Miss Dimitruk.
Yes,
Miss Dimitruk, what muscle group is this?
this is the hamstring muscle group.
Yes. How many hamstrings are there?
3.
Good. What are their names?
Biceps femoris. I didn't ask for extra hard questions.
I know. I just don't like you.
I'm gonna have to look.
Well, hey, you're. Oh, go ahead. Yeah.
Semi-membranosus and semitendinosus.
Semimembranosus and semitendinosus. Yes, you did good. Which one or ones are most lateral?
The semimembranosus
Uh,
are lateral on the inside.
well, inside is medial, my dear, right? Lateral's on the outside. So which one is kind of closest to his finger there? Which is most lateral on the leg?
I'm gonna say semitendinosus.
Which two-headed muscle found on the femur is most lateral?
The biceps femoris.
Yes. And the semimembranosus is most medial. Membranosus medial. And the semitendinosus goes along with it. So semimembranosus and tendinosus are on between your legs kind of, and biceps femoris is towards, they're all the back side, but it's the more lateral one close to his finger. Cool. Last question. Sorry, I know. Last question. What are the 2 actions of these muscles?
They will flex the knee and extend the hip.
Yes, which is why I lied, not last question, which is why they're nicknamed the what? What do they help you do?
The walking muscles.
Yes. Oh my gosh, you're on fire. Hey, for 100 extra bonus points, you described the 2 correct actions of the hamstrings, but that's actually not true for one head of the hamstring. One head only flexes the knee and doesn't extend the hip because it doesn't cross over the hip. Do you know what that one is?
I'm going to go with the short head.
Of the biceps femoris. That's exactly why it's called the short head. Yep. It only flexes the knee. Well done. Thank you, ma'am. Good stuff. Mr. Bose.
Yes.
Mr. Bose, what muscle could this be?
Mm.
What muscle group could it be? Can I run through some options for you?
Yeah.
Okay. Could it be an abdominal?
No.
Okay. Because we're on the thigh, right? So it's got to be a thigh muscle of some kind. Is it probably like one of the quads, the vastus lateralis medialis?
No.
No, it's not big enough and it's not in the right place. It's between your legs. What muscles are found between your legs?
I remember the adductors.
Yes.
Mr.
Yes.
Ibarra said Sad had these adductors.
Yes. So it is an adductor.
Was it the
And it-
adductor brevis?
Because it's short?
Yeah.
Yes, ma'am. It's the adductor brevis because it's short. Excellent. That's the type of thinking I want you guys to do. What we just did there, right? Hey, what's the action of the adductor brevis?
Adducts? Was that a trick question?
It is a trick question. It adducts the hip. It adducts the hip. It actually pulls your hips in. And what is the name for your hip joint?
I know all of these things. I promise.
No, Mr. Bose, of course you get nervous and you don't know what I'm going to ask you. I really do understand this. I've had the same thing when you guys ask me questions sometimes. And I'm like, oh, what are we talking about? And I have to kind of figure out what part of the body and everything. So, but where do you call the place, your hip joint that's kind of in your ass?
Acetabular-femoral joint,
Yes!
right?
Knock it out of the park. Way to go. Acetabular-femoral joint. Thank you, Mr. Bose. That was fantastic. Beautiful. Miss Everson,
Easy.
what is the dark red muscle here?
Is that the adductor longus?
That is probably the adductor longus because it's longer than the brevis. It's not the longest adductor. It's just the way we name stuff, right? One's junior, one's senior. Adductor longus, you nailed it. What's the function of the adductor magnus? What's its adductor longus? I apologize. What's its action?
Adduct the leg.
Yep, adducts the hip. What's the name for your hip joint?
Ah. Acetabular.
Acetabular.
Acetabular femoral.
Yes, it's where the acetabulum, the hole in your hip, hooks to your femur. Acetabular femoral joint. Awesome. Thank you. Well done. Good stuff. Mr. Godot.
Hello.
Hello, sir. What muscle is shown here in red? Not the ones in black, but the one here in red. This person, this is his inner thigh.
That's the inner thigh?
Yeah, he's laying on his side. He's doing like a sideline thing. Yeah. So medial femoral compartment, inner thigh.
Okay. So I would say, is it, that area looks weird. Is it gracilic? I'm confused. Hold on.
Well, what group is it? What group is it? Like what muscle group are we dealing with? I think you know. Because
Adductor.
yeah, this is definitely an adductor. So it's in that group. It's really big too.
Okay.
Really big.
Okay. Is it the adductor magnus?
Let's see. It is the adductor magnus. Everybody, I hope you're paying attention because what's really important too about the adductor magnus is everything's between the thigh, but look at how the adductor magnus is further back than the other adductors. The other adductors actually sit on top. Sorry. The other adductors actually sit more forward in the middle thigh. They actually rest on top. So when you're rubbing the back of somebody's leg, you're probably hitting their hamstrings and their adductor magnus because you just can't help it. The adductor magnus is so far back that it doesn't just adduct the hip, it can actually help to extend it. So it acts a little bit like a hamstring. Well done, sir. Thank you. We'll take it.
One question.
Oh yeah, please talk to me.
Two other muscles right there now?
Yeah. What are these?
Yeah, was one of them gracilis?
Yeah, it's very hard to tell from this picture, but I'm guessing this one up here is gracilis, and we just can't see it. It needs to go across the knee, and I can't tell with this person's hand in the way.
Okay, yeah, okay.
But yeah, that's why I knew you knew they were adductors. You were on the right track. Totally. Totally.
Okay.
All right. Mr. Singletary, you got your hand raised. Can you talk? No. Just is the adductor magnus on the biceps femoris? Yes, it touches it, if that's what you mean, sir. They're all on the femur, but it actually forms from the shoebox I talked about for the adductors. It actually forms the medial side of the shoebox. Oh, sorry. Oh, bad tap, Scott. Bad tap, Scott. Bad tap, Scott. No. Adductor magnus is not on the biceps femoris. Adductor magnus is on the semitendinosus and semimembranosus because they're all on the medial side. Yeah. Okay. Sorry, sir. The vastus lateralis touches the biceps femoris. It forms the other side of the shoebox. Okay. Okay. Miss Green.
Hello.
Hello. Miss Green, what muscle is this up here?
Okay, so it's in the inside of the leg, so medial.
Yep. What muscle group is found on the inside of the leg?
The adductor.
Yes, the adductors are found on the medial femoral compartment. Yes,
Okay.
that's beautiful. So we probably have an adductor here. I mean, honestly, it's not 100% for sure, but it's quite likely.
Is it adductor brevis
Does it look short?
or it's long? Oh, longest.
Yes, but remember the longest isn't the longest adductor. I like your logic now. We're headed in the right direction.
Adductor magnus.
And that was the really big one that Mr. Godot just pointed out back here, right? Really big one in back. This is kind of long and skinny. It's the only adductor that crosses over the knee. And it actually doesn't have the word adductor in it.
Oh, is it the rectus?
Well, that's not an adductor.
Across the knee. Wait.
By the way, I love your logic there because the rectus femoris does cross over two joints, and so does this muscle. And it's actually significant for that reason. So you're remembering like some of the key concepts. Starts
Is
with
it
Grrr.
gracilis?
Yes, gracilis. Cool, gracilis. Gracilis, awesome. This is really hard. I do not expect you to know this, but do you know what it inserts into down by that person's right hand, which is actually on the left side of the picture?
Is it okay? Is it the tibia?
Yes, it is the tibia. It's the medial proximal shaft of the tibia into something where two other tendons insert, and so we call it the goose's foot, but we don't use the word goose's foot. It's called the pes anserinus. Yeah, it's crazy. Anyway, pes, that will come up again, everybody. Pes anserinus. It's where the gracilis inserts, the sartorius, and the semitendinosus. 3 different muscle groups kind of come together there. But they're all on the medial proximal shaft of the tibia. Well done. Thank you, ma'am.
Thank you.
Ms. Hendrickson. I do not, and I do not mean this funny. I do not want to hurt your brain, but let's try this. What do you think this might be?
Is it a muscle or?
Yes, it's 100% a muscle.
See, it looks like it's just going from the AIS to the.
It's actually probably going from the superior ramus of the pubis to the femur. But,
Is it the obturator?
well, hold on. This is on the medial side of this person's thigh again. This is between their legs. Obturators are in your butt.
Adductor brevis?
Yes, adductor brevis would be an excellent guess.
Oh,
No, it really would be though. And if I was shown, honestly, if I was shown this picture without any other information, I wouldn't know for sure which one it was. But there's another small adductor that's not called brevis, but it's small. It's not called adductor anything.
oh. I don't know.
It starts with a P.
Oh, pectineus?
Yeah, I think that's pectineus. I actually wouldn't know that if I hadn't seen these slides before. I would be like, it's adductor brevis or pectineus, just from the picture. It's very hard to tell. Awesome. What's last question? What's the action of the pectineus?
Flex the hip? No.
It's in the
The hip?
it's in the adductor
Oh,
group.
it adducts.
Adducts the hip. Thank you, ma'am. Thank you. It's a trick question. Ms. Green, you raised your hand, ma'am.
I just had a question.
Please.
So for the pectineus, where does that start? Like where does it originally attach at? Because I see it, is that like where your pelvis is, but what exactly?
It's something called, I mean, you should, I don't mean this way it sounds, but you should look it up in your book so you can see it. But I believe its origin, which is what you're talking about, is on the superior ramus of the pubis. So if you reach down low here and touch above your reproductive organs, you're going to feel a hard bone there, your pubic bone. If you go just slightly to the right of it, that's where it would attach. We probably would never rub the origin of this.
So your pubis.
Yeah, it attaches to your pubic bone for sure, 100%. I think it's the superior ramus of the pubis because they get really technical in that area. Yeah.
Okay, cool. I was right.
Yeah,
Just making sure.
you're doing great. Cool. Thank you, ma'am. Mr. Jones.
Oh boy.
Mr. Jones, you are a weightlifter. You should know what this structure is, and I would hope you'd also know what the muscle is associated with it in red.
So
No
it's the
pressure.
quadriceps. I believe that's the lateral side of the leg.
It is the lateral side of the leg. You were correct about that.
So I'm gonna say it is the. Oh, I can't remember the outside. I know I can list all of them, but it's the.
Well, what do we call outside on our body?
It's lateral.
Okay. That's good.
What the heck? The lateralis.
Oh, the lateralis? Are you talking about one of the quads? The vastus lateralis?
Yes, vastus I couldn't remember the first word.
Sir, that is excellent because the vastus lateralis is in this exact area. However, your answer is wrong because that's not the vastus lateralis. This thing runs over the vastus lateralis. It runs over it. It's kind of weird. But you're right. By the way, the vastus lateralis is right there.
Is that the IT band?
Yes, sir. That is the iliotibial
Okay, so
band.
Iliotib.
Yeah. You can actually see how it kind of connects back into the glutes there and all that kind of stuff. So what is that tiny red muscle there that helps to tense up all that fascia of the iliotibial band? Because that's a lot of fascia you got to tense up.
Ooh. It's a hip flexor, right?
It is a hip flexor, that's true. It also helps to tense up all the fascia down there of the IT band. It's a lot of fascia.
I don't know.
What would I call a
This was
muscle?
a good one for me.
Yeah, this is a good one for you, sir. What would I call a muscle that tenses up a lot of fascia? I think I should call it, how about tensor fascia lata?
Yeah, I remember that now. Holy
Oh,
cow, that's a long
snap.
time
It is.
ago.
That's why we're doing this, sir. So tensor fascia lata is a tiny muscle that is a hip flexor because it's in front. You're 100% right. But its other job is to help tense up your IT band to give you knee stability and lock down your quads when you're doing squats or you're doing lateral movements or things like that.
Yeah,
And in
so-
a way, the IT band is a very long tendon for the tensor fascia lata
Yes.
because it
Yeah,
attaches all the way down across.
It doesn't even feel like a muscle. It's a weird spongy thing.
Sure. Well, the IT band is a weird spongy thing. It's basically a big, long, flat tendon. Yeah.
Yeah.
Cool. Thanks, sir. And that takes us, everybody, to 9:30. So let's meet back here at 9:45 and continue this path that we have started on. Okay, everybody, we're back in 1 minute. Just so you know. Yes, I saw, Ms. Savarino, I saw the email about your friends. If that's the one you meant. I haven't read it yet, but I saw it pop up. Cool. Okay. Miss Lee. Miss Lee?
Hello.
Hello, Miss Lee. Hey, Miss Lee, can you? Well, this one's hard. Miss Lee, this is not a muscle. Do you know what nerve this is? It's a nerve. You may not know. It's okay if you don't. But do you know what nerve this is?
Nerve.
Yeah.
Oh,
It's
I
okay.
don't know.
It's okay. It's the sciatic nerve. I wouldn't expect you to know. I just have it on there.
Sciatic.
Yeah, sciatic nerve. Yes,
Oh, sciatic nerve.
that's all right. All right. Do you know what this muscle is?
It's muscle.
Yes. It's inside your iliac crest of your hip. And I think you're getting feedback between you and maybe your husband's computer.
Oh, I don't know.
Okay. This is the iliacus. So say it with me.
Oh, iliac.
Yes, iliacus. Yes.
Okay.
But everybody, this is for everybody here. We don't usually, the iliacus is a real muscle. It's a really important muscle. It's very hard to massage. We usually stretch it because it's inside your hips, literally. But we don't really usually refer to it by itself. We usually refer to it with the psoas major. So almost every massage therapist in the world says iliopsoas. In fact, if you ever want some fun, ask them. Most of them don't actually know that these iliopsoas is the psoas major and the iliacus. They just kind of think of it as one muscle. And they're only called one muscle because they both go to the same place. They both insert down here in what is called, this is the greater trochanter, this is the lesser trochanter. The iliacus and the psoas major that we'll see later insert into the lesser trochanter. All right. Anyway, Miss Lee, say iliacus one last time and I'll let you go.
Iliacus.
Thank you, ma'am.
Thank you.
Mr. Lee.
Hello, sir.
Hello, sir. Mr. Lee, what muscle is this?
Correct. Iliacus.
Yes. Say it again. That was perfect. Say it one more time.
Iliacus.
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 Boom. Thank you, sir. Thank you. I'm good. Mr. Ma.
Yes, sir.
What is this muscle? I just talked about it. That doesn't mean you're going to remember, but it likes to go along with the iliacus because it also inserts into the lesser trochanter of the femur. It's majorly important. Majorly important.
You just said that just now.
Yeah, I know. This is so hard, but it's majorly important as something you should know. So, as you're thinking about this majorly important muscle, thank you, Miss Rader, she got it. So, trying to think how to help you, sir. So, as you're thinking about this, yeah, Mr. Craven just got it. Very good. So as you're thinking about the name of this muscle, which is, it's majorly important, it starts with an S.
Start with S.
Yeah. So as you're starting to kind of think about muscles in your head for this majorly important muscle, think about stuff that starts with an S and maybe has an O after it. So as you're thinking about this major muscle, hey, I got an idea, Mr. Maud, just to make it easy. Let's call it the psoas major.
So.
That's what it's called.
Maybe.
Yeah, sorry, I was trying to be helpful and I was probably being annoying. It's called your psoas major. That's why I was trying to give you a clue of, so as you're thinking about this major muscle, psoas major. It's actually called psoas major.
Psoas major.
Yes, and the psoas, there's a psoas minor, by the way, on some people, but not everybody. But everybody has a psoas major. I have a psoas minor, the rest of you don't. Sorry, superior genes. Actually, there's no way to know without an MRI. Anyway, psoas major is the name of this muscle. Here you go, sir. I know it looks like it's spelled psoas, but it's not. It's pronounced psoas major. And that muscle goes along with the iliacus, and we often refer to them as the iliopsoas, because we talk about them together, because they both go to the same place, they both create a flexion of the hip. I hope I didn't confuse you worse.
Okay, sir. Yeah, sorry, I didn't know or heard.
No, it's okay, sir. I'm not even sure we've gone, I mean, we've mentioned these before, but I don't know. Anyway, don't worry about it. Anyway, that's the psoas major. Guys, everybody, the iliacus and the psoas major or the iliopsoas are super duper important muscles that are very hard to reach because they're inside, underneath your intestines and stuff, inside your hip and everything. The psoas major actually attaches to the anterior side of your lower back. But anyway, they're very important inflections of the hip, which means they can cause what kind of tilt? Anybody? Anybody, what kind of tilt can these muscles cause in your hip? Mr. Overman.
Posterior. I get it wrong? I must get it wrong.
Well, it's hard for something in front to pull me back.
Oh, yeah, okay, anterior.
Good. Good thinking, though. He's absolutely right, though. Anterior tilt, which can mess up my spine, too. So we've got the rectus femoris now, the tensor fascia lata, the psoas major and the iliacus can all cause anterior tilt. So this is one of the muscles we'd stretch out when we get there. Anyway, Mr. Ma, do not worry about it. Just say the name psoas major.
Psoas major.
Good. And tell me the name iliacus.
Iliacus.
And let's put them together. Iliopsoas.
Iliopsoas.
Yeah, perfect. Thank you, sir. We're good. I love
Thank
it.
you.
Mr. Manzanares. Oh, by the way, Mr. Overman, you just left. Yeah, thank you. 1 second, Mr. Manzanares. Mr. Overman, you just have your hand up left over. Okay, I just want to make sure it wasn't. All right, Mr. Manzanares, we just did this. I'm reviewing to make sure everybody's kind of got this. What muscle is this?
The one on the projection, it's paralyzed. I haven't seen the image.
Yeah, this is the image. Yeah, this one.
So it's sciatic nerve? Or?
Well, you're talking about that, right?
Oh.
But what muscle is this? It's found on your iliac crest.
The iliac muscle, the one you're talking about inside?
Yeah, yeah. You pretty much said the name.
The name, yeah.
So what's it called?
Yeah, iliac muscle, right?
Yeah, iliacus.
Iliac muscle?
Yeah, or iliacus.
Iliacus.
Yeah, good. Cool, iliacus. And what's this muscle?
Iliacus.
Iliacus is correct for that one. What's this one, sir?
This from
The what?
Iliac.
Iliacus is correct.
That's
What?
on the back side or the front?
This is on the anterior side, the front side. That's a belly button there.
Oh, okay.
I'll tell you what, sir.
Abdominus.
How about so as you start to think about this muscle, this major muscle, maybe it'll come to you. So as you're thinking about this major muscle, maybe the name will just come to you. I don't know. What do you think? Do you think so?
No. Nothing's coming to me.
Nothing's coming to you? Do you know any muscles that start with the word so? Yeah. If you put so and as together and major, do you get a muscle? Put so and as together, sir.
Oh, so as.
Yeah. And then say major after it.
So as major?
Yes. So as major. So as major. So these two muscles often go together. They're called the iliopsoas together, but they're the iliacus and the psoas major. So just to review, what muscle is this?
So as major.
No, what muscle am I showing on the screen now?
The iliacus.
Yes, iliacus, perfect. And what muscle is this?
So as major.
Yes, thank you, sir. Good, good, good. Okay, Miss Osuna.
Hello.
Hello, Miss Osuna. Miss Osuna, what muscle is this?
Those are the iliocostalis.
Iliocostalis. Well, it's a pretty good guess, everybody. She just told us the hip rib muscle. Looks like it attaches to the hips. Looks like it goes to the ribs. Iliocostalis. And she's right. What is the action of that muscle, Miss Osuna, when it works bilaterally? When both sides pull, what does it do? I'm just stretching while you think about it.
Extension.
Oh, extension of the vertebral column, yes. And what's its action if it works unilaterally?
Flexion.
Flexion, lateral flexion, yes. Awesome. Thank you, ma'am. Well done. I like it. Okay, Mr. Overman. What muscle is this?
Yes.
What muscle is this?
Let's see. No, it's not. That's the not this one, longissimus.
Yes, good, sir. Because longissimus kind of grabs onto some transverse processes. You can see it doing that. And it runs all the way up to the skull and attaches where?
To the, it's not the mastoid.
It's not?
Is it mastoid? I feel like the mastoid is further to the side on.
It is. It attaches to the superior nuchal line all the way over to the mastoid process.
Okay.
That's part of its attachment to it. I'm making a big deal because lots of important stuff attaches to the mastoid process. Awesome. What action does this muscle perform bilaterally?
Bilaterally would be extension of the spine.
Expansion of the spine, cool. And what does it do unilaterally?
Unilaterally, lateral tilt.
Yes, lateral flexion, I think they call it, but still, you got the right idea. Yeah. And this is part of the back fascial line, everybody. When we have problems that run from head to toe, which usually problems do run from head to toe, this is part of the back fascial line because it actually attaches your head to your butt. And so it's a very important muscle in the long run. Thank you very much, sir. Well done. Miss Pugh.
Yeah.
Miss Pugh, I don't like this picture because it's only showing you half of the lower side and half of the upper side. But what muscle is this?
The longissimus, no, longus dorsi.
No. It's attached to spinous processes on your vertebral column.
The spinalis.
Yes, the spinalis, ma'am. Very good. What actions does the spinalis perform bilaterally?
extend it back
Yes, extend the vertebral column. Yes. What actions does it perform unilaterally?
to rotate, uh,
If one side only pulls, what does it do? What am I doing right now?
extend,
This is extend. What am I doing right now?
bending,
I am bending. I am laterally flexing.
okay.
Laterally flexing. Everybody, all three spinal erectors. Longissimus, sorry, let me say them in order. Spinalis, longissimus, iliocostalis, all three bilaterally extend the back, all three unilaterally flex, do lateral flexions in the back. Good job. Thank you. All right. Miss Rader, what do we have in store for you? Okay, Miss Rader. What do we got here? We got two different muscles here. Two different groups of muscles, really.
The multipities and the rotatories.
Good. Which one is on top of the slideshow?
The multipities,
How do you know that?
because they're longer, they expand like 2 to 4 transverse processes and spinous processes.
That is 100% correct. And there's one other thing the multifity does.
The sacrum, it's the only one that goes over the sacrum.
Thank you. Everybody, she gave a textbook correct answer. The multifity not only covers the sacrum, it jumps from 2 to 4 vertebrae at a time, whereas what's the one underneath it?
The rotatories.
The rotatories only jumps 1 or 2 vertebrae at a time.
Mm-hmm.
So her answer is textbook perfect. Thank you. Thank you. What can these muscles help you do? They can kind of help you do 2 different actions.
Yeah, can they rotate?
Yeah, they can help you.
Opposite direction?
Yeah, actually, I think you're right about that. I don't even think about it that way, but you're absolutely right because it grabs on my spinous process and back, and it turns me the opposite way. You're right. Yeah, and if they're all working bilaterally.
Extension of the vertebral column?
Yeah, guys, it's really hard to hold up your back. It's a long stack of dominoes, and so you need lots of muscles helping. Again, Miss Rader, textbook perfect. Helps you rotate to the opposite side unilaterally. Bilaterally, it helps you do an extension. I would say I couldn't have said it better myself, but you said it better than I would have said it. So, Mr. Richards. Oh, Miss Clayton, please.
What are all the muscles that attach to just the spinous processes? I know there's a few up at the top, but down toward the middle and lumbar area, are those the only two?
That attach to the spinous processes?
Yeah.
Well, I mean, all the multifity and rotatories attach to the spinous processes. The spinalis attaches to the spinous processes. And you've got what are called interspinalis muscles that you have up by your neck and in your lumbar region that are also connect one spinous process to another.
Okay.
And
so
that's not.
Why can't we massage the spine very gently if there's muscles that are attached there?
You can. You should be. I just don't want you guys to hit the spinous processes. I want you to kiss the spinous processes. When you're elbowing it back, I'm hoping that you guys barely feel the spinous process hitting the side of your elbow as you are deep in the lamina groove. And these muscles are covering over the lamina groove. Yeah. Yeah, don't be afraid of backs. Okay. Don't be afraid of backs. Okay. You will piss off a client before you damage a client with a back. Because if you run over their spinous processes, they're going to be like, what are you doing? That hurts, but you probably won't do any damage. You might bruise them. Yeah, get close to spines. Get close to spines. Yeah, please. Get in there. Yeah, don't let anybody tell you. Your spinal cord is so protected by bone. I'm much more worried about stretching it back than I am massaging it. I'll put an elbow into anybody. Bring me a 95-year-old person, and I'll put my elbow right in their back, right? Okay. Mr. Richards.
Yes, sir.
Mr. Richards, what is this muscle?
It's either is it the semispinalis? No, it's either that or the levator
No, it's not.
Well, we can work through it together. Do you want to explore those things that you've said?
It's either the semispinalis or the levator, because they're
Okay.
both in that kind of area.
Okay, so let's explore the levator scapula. That right? The levator scapula. That was
That's not attached to the scapula. So that's
good. So we gotta rule that right out. Semispinalis capitis
That's
is the
ruled out.
speed bumps of your back, of your neck. You know those two bumps we see going down people's necks? That's the semispinalis capitis. So is this kind of running side by side, parallel down your neck?
It's attached. No, it's not. But it's attached in the same sort of areas, right?
So yeah, no, by the way, semispinalis capitis was a good guess. Levator scapula terrified me, but semispinalis capitis was an excellent guess. But it's wrong. So I love to use capitis. What does this connect? What to what?
It's the spine to the vertebrae to the head.
The spine to the head. Yeah. So I like the capitis part. That kind of captures the head.
I'm trying to think of it now. Yeah, it flexes the knee. Yeah, definitely flexes the knee. That's my opinion.
Splenius capitis?
Okay. Splenius capitis.
Good. It's the splenius capitis. By the way, the splenius capitis inserts into what on the head up there? What's that bump up
That's
here?
not the. Is it the
Asper?
It's not the aspera, is it? I would usually these ones at the top.
Oh, the linea aspera?
So, yeah.
Okay. Well,
These confuse me up here. So you got the.
so sir, the linea aspera, God, I love you, but the linea aspera is a line on the back of your leg.
That's not it. Yeah.
You do have a superior nuchal line across your head, and it eventually turns into a bump here. And I'm really trying to emphasize this bump because I want us to kind of remember muscles that insert into this bump here that I'm touching on you can touch it on your head too. Yours is probably sore right now from thinking because it gets kind of tense here.
Do you know what I mean?
Yeah.
Yeah.
What's that called though, that bump?
It's not the chrome. No.
Chromium process is down on my shoulder. This is
Isn't there another one that's on the back of the head that's.
Well, there's the external occipital protuberance that's right in the back, but this is two bumps over on the side on the temporal bone. It's massively important. Let's see. Maybe it starts with an M, since it's massively important.
Mastoid. Yeah, a mastoid something.
Mastoid
something.
Mastoid something. Okay, you're halfway there.
Mastoid something.
Let's fill in something with something. Mastoid protuberance?
No, that doesn't sound.
Mastoid tubercle.
Yes. No.
No, sorry, I'm just trying to go through the process with you, sir, to help you. Just trying to kind of go through a thinking process with you. How can I help you to go through this process together? Oh my God! I didn't even realize what I was saying. Thank you. Mastoid process of the temporal bone. Awesome. So the
You
splenius.
didn't help me at all, sir. I did that all myself.
You did.
You didn't help whatsoever.
I think I'm holding you back, to be honest with you.
It's the British in me. You move aside, I'll join the class next week.
Sir, can you tell me another muscle that we've already covered that inserts into the mastoid process of the temporal bone up there?
No. Next question.
Sir, I will give you a hint on this one. It is an erector spinae muscle. And you can have as long, yes, longissimus. So the longissimus and the splenius capitis insert into the mastoid process of the temporal bone, yeah?
Thank you, sir.
Thank you. Thank you.
You said just as I wanted to.
What? I didn't hear you cut out.
You said it just as I wanted to.
Good. Good. Thank you, sir. It's been a pleasure. It's been a journey. Miss Savarino. This is the one Mr. Richards wished he got.
Right, hello.
Hello.
So this is the splenius capitis?
Well, that's the splenius capitis.
Oh, shit, my bad.
I should have given.
So
Miss-
that would,
Yeah.
let's see, so those, I mean, I wrote those.
I mean,
all
you were
down,
like you were
so I
semi
know-
right because you were in the right area, right?
Okay, so semi-capitis? No.
Well,
dang.
it goes from part of the spine to the head, and you almost said that, but you just kind of said part head.
So,
But I want to go part spine head.
so semi-spinalis capitis.
Semispinalis capitis.
Perfect.
Yes.
I knew that the whole time.
And these are the speed bumps of your neck. They are the reasons you see two lines going down people's necks. They're underneath your trapezius, everybody, but they push the trapezius up there. Awesome, awesome, awesome. Thank you, Ms. Savarino.
Thank
Cool.
you, thank you.
Thank you. Thank you. Mr. Richards.
Are you picking on me again? Are
Yes.
we going back to this tooth though?
I just want to make sure. Want to make sure we got this. What is this muscle, sir?
It flexes the knee, right?
Yes. Or extends it. Depends on which side of the ocean you're on.
Splenius capitis.
Splenius capitis. What is this muscle?
Yeah. This is my friend. Next question. I was just making a drink.
Yeah, I can tell you've been drinking. And it ain't tea.
Semispinalis.
Semispinalis what?
Capitis.
Semispinalis capitis. Yes, sir. Sorry, it went, there we go. Semispinalis capitis. Thank you, sir.
I thought we got over this tooth thing.
Yeah, we didn't. We didn't.
Okay.
I hold a
Thank you.
grudge.
Miss Dang, she gets hot.
Thank you, sir. Good job. Miss Savarino.
Yes.
I'm an equal opportunity abuser. What is this muscle here?
This is the semi-capitis. I mean, dang, I just said this, so I wasn't expecting to get called on again, dang.
I know.
So it's
I gotta keep you on your toes.
I see that. So, splenius capitis?
Oh, I like that answer. Splenius capitis. Good.
Thank you.
What's this muscle?
Semispinalis, capitis. Wait,
Yes.
semispinalis
Yes.
capitis. Cool,
Semispinalis capitis. Awesome. Thank you. Moving along. All right. Mr. Singletary,
Thank you.
I know because you've sent me emails and texts that you are having challenges, but I think you can, good. You hear me. That's what I want to know. All right, Mr. Singletary, let's see what we've got for you, sir. Sir, what is this muscle? And if you have a hard time typing it, you can always ask. Splenius cervicis. So it goes from the spine to the neck. Is that what you're seeing there? Your spelling's actually correct. Or, well, no, it's missing a U, but don't worry about that. Is this going from the spine to the neck? Because I don't think it is. And if you need help, Ms. Savarino and Mr. Richards are experts on this muscle. I can go ask Mr. Richards if you want for some help. He's just over there drinking right now. No, don't be sorry, sir. You're doing great. This is a very challenging muscle for people, apparently. I love that you said splenius because it goes from the spine, but it goes from the spine to the head. Splenius capitis. God love you. Good job. Hey, sir, stay there for a second because I also want to know what muscle group this is. There are 8 muscles here, 4 on each side. What's the muscle group called? Occipitalis. Thank you. The occipitals. Thank you, thank you, thank you. I don't care about spelling. That was really well done. Much, much better than Mr. Richards. Thank you, sir. Oh, sorry, was I? Sometimes I share out loud. Okay. That is the suboccipitals, everybody. Remember, they're about 2 fingers long, and they're found on the back of your head here, and super duper important. They essentially sew, they really do sew, your occiput, which is the bone back here of your head. So they sew your skull to C1 and C2. That's what they do. They attach your skull to C1 and C2. They're just about that much space here. Boom. All right. Cool, cool, cool. Mr. Snell.
Yes, sir.
What is this big, beautiful muscle, sir?
That is the trapezius.
Sir, you couldn't be more right. Sir, what is the action of the upper fibers of the trapezius?
Well, I know it rotates the scapula.
It can actually create like an upward rotation of the scapula. That's true. I mean, if you don't know.
I mean, elevates the scapula?
Yes, definitely. By the way, you are right. It creates an it can also create an upward rotation of the scapula. It can do some stuff to the neck, right? It can help pull your neck back and all sorts of stuff. But I love that. What do the lower fibers of the trapezius do?
Depress the scapula?
Yes, depress the scapulothoracic joint. What do the middle fibers do?
That's a good question.
It is a good question.
Adducts the scapula?
Yes, sir. It adducts the scapula, actually pulls them together and back. That was beautifully done, sir. Is there another word for adducts? Adducts is 100% correct, and that's a word I would use. But some people also use another word for when they pull back their scapulas.
Like retract?
Yes. Sir, you knocked it out of the park. Awesome. Thank you. Thank you, thank you. Miss Stevens?
Yes.
I might give you another question after this one because I don't particularly like this, but if this was a muscle group, it's disappearing because it's going underneath the scapula and stuff like that. And they've also got an abdominal in here, but that's what bothers me. But what muscle group is this in the back here?
Muscle group?
Yeah, 3 muscles is what they're trying to show you running up the back.
Is it the erector spinae?
It is. That's why I don't like this question. That's the erector spinae group. There's also the QL down there, but don't worry about that.
Yeah.
Good job. Hey, just for a little review. What? Hey, I'm so excited. Ms. Stevens, if the erector spinae group works bilaterally, both sides work, what action does it create?
Bilaterally, it extends.
Extends the vertebral column. That's correct. What if it works? What if it works unilaterally?
Laterally flexes.
Thank you. Laterally flexes. Yeah, you didn't sound very confident, but you were 100% correct. I love that. Okay, ma'am, last question. What muscle is this? It is not part of the erector spinae group.
Is that the QL?
It is the QL. So what does QL stand for?
Quadratus lumborum.
Yeah, she literally said a 4-sided muscle, quadratus, like a quadrilateral, in the lumbar region, quadratus lumborum. For $500 extra, do you know the nickname of this muscle? You can't have a sexy walk without it, I'll tell you that.
What?
Well, it helps me to elevate my hip, which, believe it or not, you do when you walk. But if you want to swish your hips like I do, you guys see me walk into a room, I pretty much command a room in these scrubs. If you want to swish your hips, you've got to kind of hike them up on each side. And so the muscle's nicknamed the hip hiker. It hikes up your hips. Sorry, let it go. All right, we're good. Thank you, ma'am. That was good. We're good. I love it. Deepest abdominal muscle. Mr. Thornton. Ooh. Aha! What muscle is this, sir? This is a good one. I know Miss Carrillo can answer this because she does the body movements with me when I say it. I like that. I don't know if you've been doing the body movements with me, sir, though, so I don't know if you're going to get it.
Yeah, I haven't been doing the body so like that. So.
All right, well, what muscle group is this?
Wait, say that again?
Just like what general muscle group is this? Don't even worry about the exact muscle, but this is, yes, it's an abdominal muscle. Thank you. That makes me really happy. It's in the abdominal region. It's an abdominal muscle. So we just got to figure out which kind of abdominal muscle has fibers that run like this.
The abs?
Yes, the abs have fibers that run like this, but there's 5 different abdominals, and I need to know which ones run like this. Not like this.
No.
But like this.
No.
Not like this, but like this. Not with my hands inside, but my hands on the outside here, like this. Going diagonal.
Yeah.
Wouldn't it be helpful if I would have taught you guys something like that? Anyway, never mind. Okay, so this is a diagonal muscle.
Internal, external?
Yes, sir, it is definitely one of those. Which one is it? It is internal or external oblique. Oblique means diagonal, everybody. Oblique.
Yes, that's what I was looking for in my paperwork because I just wrote this stuff down, rewrote it down, so I won't forget because I kind of figured something was going to get called out.
Yeah.
So it's internal.
Yeah. So if I put my hands in my pockets like this, they run diagonal like this. And that's an oblique. And if I put them on the inside of myself, they run the opposite direction. And that's kind of how I remember internal, external obliques. So these are running this direction. What should we call them? Internal or external?
Internal or external?
Yes, external. Internal would be like this because my hands are on the inside. Good job. External obliques. Cool, cool, cool. If they work unilaterally, one side only, what action do they perform?
Does it flex?
It does. By the way, there's truth to that, everybody. He's right. It's diagonal muscle. It's always going to flex. Something else has to stop that from happening. But if it doesn't let you flex, it's going to rotate you, sir. And is it going to rotate you to the same side as the muscle contracting or the opposite side?
The opposite.
Yes. If I grab my pubic region here and pull, I'm actually going to turn that way. Good job. Thanks, sir. External oblique. Boom. Okay. Miss Young. It's time for you to show Mr. Thornton how it's done, Miss Young. What muscle is this?
The internal obliques.
Bam. Immediately. Internal obliques. Because if I ran my hands this way, I'd be doing the fibers that way. Internal obliques. Internal obliques. And what kind of action can these create working unilaterally? One side only.
They would rotate you to the same side.
Which makes it look easy. Yes, you're 100% correct, ma'am. By the way, if they work bilaterally, everybody, they'll help flex you. They do help flex you. Yeah. Very good. Thank you, Miss Young. Miss Abelos, you have sound and you are ready.
Yes. Hi, can you hear me?
I can. Miss Abelos.
Oh,
Yeah. What muscle is this?
that is the rectus abdominis.
Yeah. What action does it create?
It flexes the vertebrae column and it tilts the pelvis posterior.
That was actually really cool. I didn't even, you're 100% correct, ma'am, by the way. Everybody, it flexes the vertebral column and it actually can create a posterior tilt because it pulls up the bottom of my pelvis, which pushes the top back. Really well done. You know, ma'am, I feel like you have been cheated, wouldn't you say?
No.
No, ma'am, I feel like you have. And I want to treat all my students with respect, right? You were having voice problems. There's probably many questions that you didn't get to answer, right? on the way up here, right? So just really quickly, what muscle is this?
That is your rectus femoris.
Yes.
Off of the AIIS.
IS. What muscle is this?
That is your vastus medialis.
It's not on the medial side.
I'm sorry, lateralis.
It's not on the lateral side.
Intermedius.
Yes. What muscle is this?
That's your vastus lateralis.
Yes. What muscle is this in the teardrop shape there?
Vastus medialis.
Yes. What muscle group's this?
That's your hamstrings.
Yes. What muscle or muscle group is this even?
That is your adductor brevis, although it looks like pectineus.
Yeah, it's really hard to tell, but adductor brevis, beautiful. What muscle's the darker red one here?
Longus.
Yes. What muscle is this? The big one in back here?
That is your adductor magnus.
Yes. What muscle is this? Goes across the knee?
That is gracilis, although it is a weak adductor. It's
It is.
actually for medial rotation.
Yes. And what's really important is it gives medial stability to the knee too.
Correct.
Beautiful. What muscle is this?
That's your pectineus.
Yes. What?
Wait, are we still going?
We're still going. Focus. Focus, ma'am.
That is your IT band with your tensor fascia lata.
Good. What nerve is this?
Sciatic nerve.
Good. What muscle is this?
Iliacus.
Yes. Why is my thing stop? Okay. What muscle is this?
That is psoas major, even though minor could be in there. Though.
Yes, it could be. Absolutely. Yes. What muscle is this?
That is your iliocostalis.
Good. What muscle is this?
Longissimus.
Yes. What muscle is this?
Spinalis.
Yes. What two muscles are these?
Multifidi and rotatories.
Yes. Awesome. What muscle is this? This is Mr. Yeah.
I'm sorry, go ahead.
It's Mr. Richard's favorite muscle.
Your spinalis capitis.
Yeah, splenius capitis, but that's really good. That's great. What muscle is this?
Semispinalis capitis.
Yes. What muscle group is this?
Suboccipitals.
Yes. What muscle is this?
Trapezius.
Yes. Forget that. What muscle is this?
The quadratus laborum.
Yes. What muscle is that?
External oblique.
Yep. What muscle is this?
Internal oblique.
And you already told us this is rectus abdominis. Thank you, ma'am.
Thank you, sir.
All right, Ms. Carrillo. Well done, by the way, Ms. Avalos. Sorry, I was just messing with you, but you did great, man. Ms. Carrillo, what muscle's this?
The internal obliques.
Hold that thought 1 second. Mr. Godot, you raised your hand, sir. Yes, sir.
Did I miss my turn?
No, you did not.
Okay, I was so scared. I heard.
You're wonderful, sir, but you did not miss your turn. Thank you for asking.
All right, cool.
And good of you to check in, though. Thank you. Ms. Carrillo, what did you call this now?
The internal obliques?
I thought these were the internal obliques.
Oh my gosh. That's the transfers.
Yeah, I know why you did it, but they really do run across, right? They run across like a band, right?
Yeah.
Yeah. And remember,
I was looking at the fibers. I'm like, that doesn't feel right.
remember the transverse abdominis, everybody, it's like a giant sphincter muscle, and it creates a belt, and it compacts all the contents of your abdominal stuff and builds up abdominal pressure inside so you can stand erect and such. Very well done. Thank you. What's this, Ms. Carrillo?
The sternocleidomastoid process.
Yeah, that's it. Sternocleidomastoid.
Okay.
You want to throw process on there because it does go to the mastoid process, but it is sternocleidomastoid, SCM. Well done. Hey, what action does it produce if it works bilaterally?
This is the praying muscle, so flexion
Yes, flexion of the cervical spine or something like that. Yeah,
of the knee. Okay.
nicely done. All right, thank you very much, ma'am. Miss Clayton,
Yes.
what muscle is this?
Deltoid.
Good. What's the action of the middle fibers of the deltoid?
Lateral extension.
That is a neat, I mean, by the way, I think you are correct, but you didn't label it correctly. What do we call when I do this?
Hold on, you went away. I can't see you. Sorry. Lateral abduction.
Yeah, abduction is lateral, by the way, but that's awesome. And I love actually what you did. Your play on words was actually quite accurate. All right. Thank you, ma'am.
Oh, give me more.
Oh, good. All right. Well, good. Miss Clayton, yeah, I don't want you to feel left out. Miss Clayton, what do the anterior fibers of the deltoid do?
What's that called? Forward frontal flexion?
Flexion. Flexions happen in front. And because it goes diagonal, what kind of rotation can it create?
Internal.
Yes, internal or medial.
Medial.
Medial rotation, internal rotation. And what can the rear fibers of the deltoids do?
Extension.
Extension,
And
yes.
Can they also do medial retraction?
Medial retract. You're making up all sorts of neat new moves. Medial retraction.
Well, they kind of can they turn your, no, they can't.
Can they what? They're diagonal and back too.
Like back end of your scapula.
They can rotate your arm as well. But they're in back. So what do we call it when my arms rotate back?
Extension.
That's when they go back.
Flexion.
What do we call it rotation where they go back like this? You just told me what a rotation was, internal or medial.
Medial.
So what's this
Medial.
rotation? What's the opposite of medial?
I don't know. Oh, lateral.
Thank you. So the back ones can create a lateral rotation. Absolutely. All of this, of course, is happening around the joint in here. What's this joint called?
Acromioclavicular or the glenohumeral?
Glenohumeral. She is right, by the way. There's an acromioclavicular joint here, but it's the glenohumeral where the humerus and the glenoid form a joint. What kind of joint is that there?
The ball and socket.
Ball and socket. Pretty good ball, pretty lousy socket. Yeah. All right. Cool. Last question, since you asked for so much. Tell me the origin of the deltoid, which happens to be the insertion of the trapezius.
I think that's is it the acromioclavicular?
Well, it does. The acromion process is there. Yep.
But it also.
It starts here, attaches, goes around here, and goes all the way back here. So if you trace that bony thing, what do we call all this? You have to kind of name it as you go.
Oh, the spine of the scapula?
All right, spine of the scapula turns into the acromion process, which turns into what?
Oh, the coracoid process?
How about clavicle?
No. Oh, just the clavicle?
Yeah.
Clavicular joint?
So the origin for the deltoid, which is the insertion for the trapezius, is the lateral 1/3 of the clavicle, acromion process, and spina scapula.
Oh, 3 different.
Yeah, if you put your finger here on your collarbone and push it out, it will turn into the lateral 1/3 of the clavicle, will turn into the acromion process, and if you keep going back, the acromion process turns into the spina scapula. And that's the origin for the deltoid, and it's the insertion for the trapezius.
Wow, okay.
Which is why the trapezius and deltoid kind of work together in the shoulder girdle complex kind of thing. It's very cool.
Okay.
Thank you, ma'am.
I didn't think that trapezius stuff came forward.
I know people don't, but it actually comes up here and forward, which means you can actually hook your finger inside some people's trapeziuses. It actually folds over here in front. We don't think about it because when we squeeze it, we think it's all one muscle, but it's actually going around the shoulder and it actually is folded in there in front. Very much so.
Oh, now I understand.
Yeah, it's all coming together. Yeah.
Coming together.
That's actually why we do these reviews, because we know that you pick stuff up in layers, right? And so good. Thank you. Mr. Ma. You had a question, sir?
Yes, sir. Yes, sir. Could you please show me the last muscle very quick?
Yeah. The sternocleidomastoid?
Oh, yes. I just want to write down the name.
Sure. And sir, it's going from the sternum and the clavicle to the mastoid process. I usually make this hand signal to remember it. And Ms. Everson's right. It is the prayer muscle. It creates a flexion.
Okay.
But what else is significant about it is it inserts into the mastoid process. So now we've got the longissimus inserting into the mastoid process, the splenius capitis inserting into the mastoid process, and the and the sternocleidomastoid inserting into the mastoid process. Kind of cool. So this is a high tension area that we want to rub on people. Yeah, cool. Mr. Singletary, please text away your answer or your question. Is levator scapula underneath the SCM, the sternocleidomastoid? No, sir, because look at me. This is my SCM. My levator scapula is back here. It's got to levate my scapula. It's back here. Right? I mean, I guess maybe, yeah, okay, cool. Thank you. Ba-da-ba-ba. We're not doing that. Mr. Craven. Sir, what is this gorgeous large muscle in red here? There's a lot of other muscles going on here, but the one in red.
Latissimus dorsi.
Oh, the muscle that's found laterally and on the back, latissimus dorsi. That's a great name for it. What are the two? Well, actually, I can think of three. What are the actions of latissimus dorsi?
Does it adduct the scapula?
100% correct, everybody. If my arm is up like this massive wing, it is a wing, adducts. Adducts. That's why we do pull downs at the gym, right? So adduct is one thing it does.
Got one.
Got one.
Oh, there's two.
Is there another way for my arm to get down without adducting?
What's another way for your arm to get down without adducting?
I can bring it down here. Is there another way for me to bring it down?
Drop it.
But if I drop it here, it's called adduction. Is there another way for me to drop it? This is dropping in, I know this is confusing, but I'm trying to make a point.
The elevation?
Well, no, elevation's going up. How do I get my arm down? If I don't drop it to my side, how can I get my arm down?
This is really confusing to me.
Can my arm come down this way too? Because this is in the...
So is that like a medial de-elevation?
Yes, it's a medial de-elevation with a hip hike with a lateral twist and a triple dismount. Sir, when a joint is coming from the front to the back, what do we call this? Come on, extend your mind. You can do it.
Oh, extension.
Yes. So I can extend, which happens, by the way, in the sagittal plane as opposed to the frontal plane. So I can extend to get my arm down, which is why I can do pull-ups like this, and that works my lats, and I can do pull-ups like this, and that works my lats. Cool. So the lats do just bring your arm down next to your body. There's no doubt about it. But you can do it adduct or extend. Sorry. There's one other thing they can do because they reach up underneath my arm and grab on in front. So there's something else kind of cool they can do. Yes, they can rotate my glenohumeral joint. What kind of rotation? Is it a lateral
medial?
flexion? Yes, it is. Good, medial. Yes, medial rotation, exactly, which is honestly why bodybuilders do this thing where they do that and their lats pop out. They are immediately rotating and flexing their lats. Very cool. Thank you, sir. Good job. Sorry for confusing you. Ms. Dang. Miss Dang? Miss Dang? Oh, Miss Dang. Don't let me scare you off, Miss Dang. Answer. No? Okay. Last call for Miss Dang. All right. Miss Dimitruk. Miss Dimitruk. It is. Thank you, by the way.
It's gonna be the major.
I love that. I love, by the way, what she said. She said it's a Terry's. And she's right. She knows the Terry's are in that area. Why do you think it's a major and not the minor?
Because it's a little bit lower. The minor's gonna be up there in that rotator cuff.
They both attach. Yeah, you're 100% correct on all counts, ma'am. They both attach to the lateral border of the scapula, but the minor rides on top of the shoulders of the major. The major actually attaches all the way down. It starts at the inferior angle, and you can see the inferior angle of that scapula right there. So this would be major, Terry's major. Yeah, Terry's major. Anytime I say Terry's major, you say?
Latissimus dorsi.
Yes, because what are the three actions of the Terry's major?
Those same actions of the latissimus dorsi.
That Mr. Craven just did. And what were those three actions?
You could just tell us those again.
Yeah, I almost want to call on him to ask him, but I want you to tell me what this is, and what this is.
We got some medial rotation here. We've got extension here and adduction.
Yes, 100% correct.
Abduction?
Add. You're adding your arms back to your body. You're adding, adduction. Beautifully done. Thank you, ma'am. Thank you. That's why we put these two muscles together. Yeah. And they insert in close to similar places. Yeah. Miss Dang. Hello.
Yeah, sorry, my screen freeze there.
That's okay. It was only 1 minute and you got us.
Yeah.
Good. All right. Miss Dang, do you know what these two muscles are? Two muscles. It's okay if you don't, but do you know?
Yes. There is the one I couldn't see the screen, but the one you just asked me that is teres major.
Yeah, so what are these two muscles? Because you're right. One of these is the teres major.
And latissimus dorsi.
No, latissimus dorsi is too big. It's too big. Latissimus dorsi is back there.
Teres major, teres minor.
Yeah, stop right there. Teres major and teres minor. Yes.
Yeah.
That's the two.
Thank you.
Wait, what's the last question, Miss Dang? Which one's on top?
Teres major, minor.
Right. Because if you had to carry your minor around, Allison is your minor, she's your little girl, your minor, you would put her on your shoulders. You would put her on top of you. The minor goes on top of the major.
Yeah.
That just helps me remember.
Okay.
Thank you, Miss Dang.
Thank you.
Good job.
Thank you.
Cool. Okay. Mr. Bose.
Yeah.
Mr. Bose, what muscle is this?
My screen is frozen. Give me 1 second.
Mr. Bose. Do.
Wait, can you hear me?
Oh, I can hear you.
Okay, just making sure. Hold on. Is that the infraspinatus?
It is all day long. Awesome. Infraspinatus. What is the action of the infraspinatus?
It's a great question.
It is. It's a pretty good question.
Infraspinatus. Hold on. Let me try to do this with my shoulder. So, is that retracting your scapula? No.
What muscle group is the infraspinatus in? Like it's part of a 4-muscle group. Do you know what muscle group it's in?
Yes, I do know it's on the tip of my tongue, and I know all the muscles.
No.
in
It's on the tip of your shoulder.
Rotator cuff?
Yes, the rotator cuffs. So it's highly likely that this muscle rotates. So what kind of rotation would you do? If I grabbed onto the back of your shoulder and pulled on it, what kind of rotation would it create?
Lateral rotation?
Yes, 100% correct. Lateral rotation. And last question, Mr. Bose. If I say infraspinatus, you say what?
Teres minor?
Yes, because it's small and teres minor is small, which means the teres minor also produces what action?
Lateral rotation.
Yes, and that's why we put them together. Thank you, ma'am. Good job. Good. Ms. Everson, what muscle is in red here?
That is the, I want to say teres minor.
I want you to say teres minor. Good. Infraspinatus and teres minor. Good. Mr. Godot. Mr. Godot, this is a rotator cuff muscle. What muscle are we looking at in red, sir? It's a rotator cuff muscle, just to help you a little bit.
I'm honestly, hold on, give me a second. I'm gonna look it up. I'm not even gonna lie to you. I'm not sure.
Can you say I'm gonna put you on the spot. Can you tell me your 4 rotator cuff muscles?
Yeah, I believe so.
Okay.
No, I'm looking it up. I'm not gonna lie to you. Give me one second.
Well, let's do the 4 rotator cuff muscles: the supraspinatus, infraspinatus, teres minor, subscapularis.
Oh yeah.
Good. So tell me those 4, and then I'll help you figure out which one this is.
All right, supraspinatus, teres minor, infraspinatus, and then subscapularis.
Good. So based on their names, which one would you think this one is? If this person was
supraspinatus.
Well, supra means on top, so we find that one on top. Does this look like, is your armpit on top?
No.
Good.
But that, okay. Yeah, no. Hold on. Is it subscapularis?
Yes, it's found. I know it's in front here, but if this person was laying face down, it would be found underneath the scapula, and that's why it's called subscapularis. Good job, sir. Good job. Thank you.
Thank you.
Miss Green.
Yes.
Miss Green, what muscle is this?
Shoulder.
Yeah.
Did somebody just say?
What?
Did somebody just say that? Subscapularis?
Well, is it under the scapula? Sub means under, like a subway or a submarine. They go under the water. Is this muscle under the scapula?
No, it's the teres minor.
Really? Hey, what's this bony structure right here on the scapula called? This bony structure right here on the scapula. What's it called? This bony structure. This bony structure on the scapula is called the spine of the scapula.
Spine of the scapula.
So now what's this muscle called? This muscle that's above the spine of the scapula, what's it called?
Supraspinatus.
Yes, thank you. Thank you, Mr. Singletary, too. Supraspinatus, yes, ma'am. Spine of the, it's, which literally means above the spine of the scapula. Supraspinatus, above the spine of the scapula. Cool. Last question, Ms. Green. What action does this muscle perform? It performs one action. It's up here on top. What does it do?
It adducts away.
It
Or
adducts.
abducts.
Oh, abducts away. She's 100% correct. Good job, ma'am. No, that was excellent. It abducts. Yes, it abducts. Awesome.
Or you could say extends, I guess, right?
No,
Or flex away.
no, no. Flexions and extensions happen in front and back. Abductions and adductions happen out to the side. So I like, no, don't be sorry. I like your logic. But anyway, you were right. Abducts. It lifts my arms up out to the side. Awesome. Thank you.
Thank you.
Boom.
Hey, you didn't call on me before, did you? Like, I know you called on me first time, but like,
Oh, are you,
I didn't miss you.
you didn't miss anything. Are you upset I haven't been calling on you enough?
No.
No, Miss Green, no, Miss Green. I have to apologize. Let's review. I feel terrible. All right.
No, don't feel terrible.
No, Miss Green, I do. I am not giving you the respect you deserve. Miss Green, what is this quadricep muscle?
Is it the vastus intermedius?
That would be a good guess, but it's longer than that.
Rectus femoris.
Yes, good job. Rectus femoris. What's this muscle? You just said it.
Oh, okay. Vastus intermedius. It does. It kind of looks like it's outside.
Yeah, but you can't see the outside if you think about it. That's over on. What's this muscle, speaking of outside?
Vastus lateralis.
Yes. What's this muscle in the teardrop shape?
Vastus medialis.
Yes. What's this muscle group?
The hamstring.
Yes. What's this muscle?
It's a hip adductor.
Adductor, yeah. It's a short one.
It's adductor brevis.
Yes, adductor brevis. What's this one? It's a little bit longer than the other one.
Magnus.
It's not a little bit bigger, it's a little bit longer than the other one.
Oh, longest.
Yep, adductor longus. What's this big one? Big. If I had a really big handgun, I don't think I'd call it pectineus. If I had a 44 pectineus, 44. Let's call this.
It's still an adductor, though. Is it adductor magnus?
Yes, adductor magnus. Good. What's this one? Starts with a G.
Gracilis.
Yes. And here you go. Here's your tiny one. What's it called? Starts with a P? Pectineus. Beautiful. That's your adductors. Awesome. What is this?
Where is that, the leg?
Yep. Outside of the leg. It's a big band or tract. It goes from your ilium to your tibia.
Oh, is it your is it the sciatic nerve?
No. Goes from your ilium to your tibia.
Iliocostalis?
Iliotibial band?
Iliotibial band.
Or tract. Awesome. Thank you, ma'am. And that's the tensor fascial lata muscle there. What's this? Here, you already said this. This is in somebody's bottom. It's a nerve. I think you said it already. It's a nerve.
Just now?
I feel like maybe I'm losing it. Shoot. Sorry.
Oh, wait, sciatic nerve?
Aha. Sciatic nerve. Good. What muscle is this inside the crest of the ilium?
Is that the stomach?
Well, yeah, but it's inside your ilium. How about iliacus?
Iliacus.
Cool.
Okay, yeah.
And what's this? What's this major muscle?
It's in the abs.
Yeah, but it's below the abs. It's deep in there. And I always, let me help you with this. So as you're thinking about this major muscle, I really should come up with a better clue for this. So anyway, so as you're thinking about this major muscle, try to catch if I can give you a clue to it. So as you're thinking of this major muscle, what kind of clue can I give you? Something so as you're thinking of this major muscle would give you a clue. Starts with an S. The sound does. It actually starts with a P, but you don't pronounce the P. Shoot, what could I be more clear that would help you without giving it away? So as you were thinking about this major muscle, what could I say that would just tip you off? Starts with an S and an O, kind of like so, by the way. So as you're thinking about this major muscle, that starts with an S and an O, so as,
So it's major?
so as major! Oh my gosh, why didn't I give you a clue like so as you're thinking of this major muscle? So as major, yes, ma'am! Ah! All right, everybody, so as major, everybody, super important muscle causes anterior tilts of the pelvis and all sorts of stuff. So as major, we often call these together the ilio-psoas together. Anyway, all right, yes. Okay, and we got to stop right there, everybody. I don't have time to pick on anybody else, but it's been very rewarding picking on you, Miss Green. It's all in jest. I hope everybody knows, and I know it's not even or fair and all that kind of stuff. Life is not that way. Hey, we've got 5 minutes left, so I wanted to